رسله وقالوا سمعنا وأطعنا غفرانك ربنا وإليك المصير لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إصرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين.
Welcome back in Micro Mayhem. Today we will continue our CBIC series. Today I'm going to talk about Jakob disease, CJD. So how it is infectious, and at the beginning the scientists thought it's a virus disease. Okay, then in 1980 the understanding shifted, proposing that the etiological was not viral but rather an infectious protein particle unique for its lack of nucleic acid material. So prions replicated in the central nervous system, distributing crucial neuron functioning and leading to rapid neurological degeneration and certain death. So scientists observed unusual neurological degeneration leading to CNS collapse and death. So autopsies revealed extensive loss of normal brain tissue replaced by a spongiform cell, appearance with little tissue inflammation, and so on. So associated disease like Kuru in 1957, CJD became linked to Kuru, another slow virus disease, and it identifying among the four native of New Guinea, as they have rituals. They used to eat or ingested the family members who's dying of shivering disease, which directly led to its transmission to women and children. So grouping of the disease over time, CJD was grouped with other human neurodegenerative disease such as GSS syndrome and fatal familial insomnia, and animal encephalopathies like scabies and bovine spongiform cephalopathy BSE, which is made of cow disease. This category of neurological disorders became known as transmissible neurodegenerative disease or transmissible spongiform encephalopathies TSES. So this disease share characteristics such as neurological manifestation, primarily in the CNS, sometimes long incubation periods, and progressive, ultimately fatal outcomes. So, and characteristic for sure of spongiform transformation in brain tissue without an inflammatory response. With regard to the CJD molecular properties of prions in general, so there is many forms of prion. BRP form, which is prion proteins, are normally synthesis in the brain tissue. Research largely using scrappy infected animals modules identify two forms of prion protein. There is prion BC or cerebral, the normal isoform predominantly found on cell surfaces of unaffected animals, rapidly synthesized and degenerated with only 3% sheeting in its secondary protein structure. There is also prion BSC, which is prion protein scrappy. The abnormal proteases resistant isoform primarily found in affected containing 43 of sheeting in its secondary protein structure and is slowly synthesized in the degraded. So there is also talking about conversion and accumulation of a protein prion. Prion protein scrappy accumulate within cell primarily in the cytovacuoles or cytoplasmic vacuoles and the lysosome. It arises from a conversion of normal protein prion protein cellular to the abnormal protein prion protein scabies isoform after an infectious dose of prion protein scabies is introduced into the brain. So when prion protein scabies interact with prion protein cellular, it's cause an unfolding and refolding of the protein conformation, leading to an exponential conversion of prion protein cellular to prion protein scabies. This cascade of abnormal of prion protein scabies accumulation result in neural dysfunction through the exact process not clearly defined yet. So according to the Jakob disease genetic link, the prion protein gene is located on human chromosome 20 and play a crucial role in prion disease development. Mutation in the prion protein gene are responsible for inheritable human prion disease, including familial, CJD, and GSS syndrome, and fatal familial insomnia. Types of and characteristics of human prion disease are known to occur sporadically by gene mutation or familial, iatrogenetically, and by ingestion of contaminated meat product also. So there is also sporadic CJD, SCJD, rate 1 cases per 1 million population and account for 85 to 95% of recorded CJD cases. There is also familial CJD due to genetic mutation or inheritable and documented in geographical clusters. There is also iatrogenic CJD caused by the introduction of prion laden tissue, example transplanted dura mater and precardium cornea, pooled pituitary hormones preparations, or contaminated neurosurgical equipment during invasive procedures. There is also variant CJD in 1995 recognized in patients younger than 50 between 16 to 48 associated with consuming contaminated meat products, particularly from BSE infected cattle. Unlike CJD, VCJD present with prominent sensory and psychiatric defects, including pain, dyslexia, and defects, and including the dysesthesia and depression and psychosis and anxiety. Pathological characteristics such as amyloid plaque distributed in the cerebrum and distinct from SCJD and prion protein scabies from variant Jakob disease. So regarding to the clinical presentation, classic CJD manifested as a rapid and progressive dementia combined with ataxia and myoclonic and seizures, visual and sensory defects, abnormal psychiatric behavior, and coordinator defects, and mental deterioration is rapid with an average time from symptoms onset to death of 7 to 9 months. Regarding to its diagnosis, direct examination of brain tissue revealed neuronal loss and reactive gliosis and neuronal vacuolation or spongiform appearance without inflammatory cells. So CSF could analysis release 14 to 3 protein, which is the useful report 95 of Jakob disease patient, though it can show a false positive in other conditions. So immunological test for prion protein scabies in brain tissue, autopsy or biopsy are sensitive and specific. So also I will talk about GSS syndrome, genetically transmitted autosomal dominant prion disease, rare from 1 to 10 cases per 100 million in year. It's caused the disease for 43 to 48 years with about 5 years duration. Progressive of Spinocerebellar degenerations and dementia, affecting intelligence and memory, attention, cognitive thinking, and the skills. Diagnosis with visual examination of a brain tissue for amyloid plaque, primarily in the cerebellum. So also there is FFI, which is a fetal familial insomnia. Genetically, it's a Prion disease. Insomnia, characteristic with insomnia with dysautonomia. So there is tachycardia, the symptoms of it, and hypertension and motor defects. So also there is hallucination or hallucinations, memory problems, and confusions. It's coming for age 36 to 61 years in a course of 13 months until death. So it's important to also how to solve this infection prions by eradication, evolves chemical or increased temperature extended cycle of sterilization or a combination of them. Also this could if we want to less than 3 log reduction in 1 hour, we should combine chemical like acetone, ammonia, and chlorine dioxide, and ethylene oxide, and ethanol, and so on. So standard standard gravity displacement steam sterilization at 121 degree, even for 15 minutes or 120 minutes, it's only a partial effective. Also, we should add chlorine with dilution of 1 to 10 for sodium hypochlorite for 15 minutes. Also, for the surface, we should soak it in formic acid. Soaking is required for inactivation in tissue specimen, and the corrosive nature of chlorine and sodium hydroxide, sometimes it's affect, so we should take care of it affect instrument like endoscopes, so we should take care of this point. So according to WHO, we should combine chemical treatment like sodium hydroxide and sodium hypochlorite with autoclaving at 121 degrees centigrade or 134 degrees centigrade for extended time. So there is and we will sterilize the equipment according to is it critical items like treat the brain directly or it's low risk contact. So for the low risk contact, we should also just treat it by conventional method, but for critical, we should like surgical instrument, we should be care of it and follow the WHO guideline. In the last, I think Jakob disease and Prion disease, it's rich and it's a good topic to dive on for CBIC study group. Thank you for listening, and we will back again